Swelling or too much Restylane under eye. I had my first Restylane treatment last Saturday morning. It was done by a doctor using cannula. I was fine Saturday. Sunday morning, when I woke up, both my eyes were swollen shut. I iced without any reduction. I did not have bruising, only a lot of redness and swelling. I started myself on Prednisone, 40 milligrams, and was planning on tapering down tomorrow. My left eye has a swollen bag under it and looks horrible. I had hollowing under eyes before, but never had bags. Please tell me what I should do.
Thank you for your question. You submitted 2 photos, and with those photos you state in the history that you underwent filler with hyaluronic acid filler placed with a cannula, and that the next day both your eyes were swollen shut, and that they didn't respond to ice, but you then placed yourself on prednisone and you're tapering it down, and you've noticed in the time as the swelling resolved that you have these lumpy areas and you want to know what to do. Well, I can certainly give you my perspective in your situation. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. Injectable fillers such as Restylane is something I use in my practice every day, and in particular to help people look good around their eyes. So in analyzing just your history, I would first start by asking you to reach out to the doctor who actually performed this procedure. You know, you are very certainly resourceful by putting yourself on prednisone, but it is important to have medical supervision when you take a drug like prednisone, and there are certain things that just doesn't sound right to me from that history. The question really is did you have any type of allergic response to the hyaluronic acid filler? Now, in general, that seems unlikely. It's so exceedingly rare that we don't routinely do skin testing for people to the filler before we do the injection. Before the hyaluronic acid fillers, I was injecting collagen, and this was derived from a bovine source. So we used to have to inject people in the forearm and you just check the skin like you do for the TB test and see if they would be sensitive. So it makes me wonder if there's anything else that you might have been sensitive to that caused your eyes to, quote, swell shut. Was it a topical anesthetic? Was it a moisturizer? Was it makeup? You need to get to the bottom of this to avoid getting your eyes to, or any other areas to react so strongly after a treatment. Clearly the prednisone has been of value, and certainly in an allergic situation prednisone can be useful, but you should still either discuss this in detail with your doctor and meet maybe with an allergist to figure out why your eyes got so swollen and shut. As far as the lump is concerned, I think it's pretty clear that it's most likely a little bit of excess filler material that is in an undesirable location. So I would probably recommend that that you have the material dissolved with hyaluronidase, because it looks like it's in a place that you don't want it to be. This is a very common problem. People come to me from all over the country with the concern where they've got injectable filler in an area around their eyes, and then they got an undesirable result. And so I routinely actually use hyaluronidase to dissolve the material and then to kind of start from scratch, because sometimes the situation is such where they'll get the filler and then they'll get more filler on top of that or adjacent to that, and it can kind of get a little bit messy and unwieldy. But again, getting back to the original question, you have to figure out what you were sensitive to that caused your eyes to get swollen shut. Allergy is something you don't want to just kind of sweep under the table. You want to really look at what could be possibly a cause and get an appropriate workup. So I hope that was helpful. I wish you the best of luck, and thank you for your question.